Good evening. The news gang is here. Tonight, COVID-19 goes viral. The third wave is here and no freedom is coming tomorrow. We preview the president's speech. Also tonight, the handshake and fists. The rumble in the BBI jungle 3 years after the truce. Jamila's memo is co-authored from Isiolo. Straight talk from an ordinary voter. Gashuri punches into the animal farm of COVID-19. Yvonne takes on the MPs who'd rather summon the NCIC and not the other way around. The kicker is about that place where hypocrisy meets the rule of law. And on the angle tonight, the referee is limping before the match.
Sio mwisho wa safari. Na tunataka kuhakikisha ya kwamba Wakenya wote wameweza kupata chanjo ambaye itawasaidia kuzuia huu ugonjwa.
Essentially is the ammunition that we need to fight this coronavirus war. They are tantamount to the bazookas, guns and tanks required for war. With them, we are now indeed fully fledged to fight COVID-19 like an insurgency.
All right, so Wilson Mushora is doing for us the sign language interpretation, and the show will start now. Just breaking news, Lenas, we are getting in the last hour or so, ODM Raila Odinga announcing, I think the doctor announced, and then shortly after issuing a statement to say that he's actually tested positive for COVID-19.
That's right, that confirmation coming in just under the last hour, and the ODM leader has been in the hospital for the last 3 days now, having checked in.
It's the third night tonight.
Yes, 3 nights now. And he had checked in, if you remember the early reports, because of fatigue. Remember, he had just completed a very, very extensive tour of the coast. And now the news comes in that he is COVID-19 positive. There's something that should be can be observed about this as a step. The fact that they've announced and made it official. Don't hide it. Just announce that if it's COVID, it's COVID-19. Many other Kenyans have been victims of COVID-19 because there has been an impression in Kenya that, hey, leaders don't get COVID-19. But this is just a statement also that it is around. COVID-19 is real, like he says in his statement. And the third wave is ravaging the country. 91 patients in ICU, according to the statistics from the Ministry of Health today. So COVID-19 is real.
Yeah, Joe, it's true. COVID-19 is real, and I concur with Linus, what Linus has just said, that it's important that this information is out there because speculation makes things worse. At least now we know that ODM leader Raila Odinga is in hospital and he tested positive for COVID-19. And yes, we're talking about the third wave. I was looking through some statistics about infections in the country, looking through how it's been month on month from when we had the new case in March when we had 59 cases up to around June when it started peaking. We had 4,000. July, we had over 14,000 new cases. August, 13,000. It went down a bit in September. And remember, at that time, we eased some of the restrictions which had been put in place. At that time, we had about 4,000 cases. Then it peaked again in October when we had about 16,000 new cases of infections. And then November is one of the highest month, actually, since COVID-19 was first reported in Kenya when we had over 28,000 people testing positive. Went down again in December slightly. January had 4,300, one of the lowest months. February it started climbing again, 5,200, and up to today, March 11th, we have 5,212 people who've tested positive. As you can see now, it went down, it started going up again. And if you look at the positivity rate month on month in terms of percentage, we had the highest we had was around October, it was 10.6, no, November actually 14.6%. December went down to 7.5. January we had 2.9%, one of the lowest. And remember, that was around the same time schools were opened, people had come back from from the December holidays. They had been worried about the numbers going up. They didn't. But we are seeing in February it goes up to 4.8. And March 11th, we have 9.7% positivity rate so far. The numbers are going up, we are being told. And I think one of the worries that the people have the world over are the strains, the new strains. We are told officially that we really do not have the other strains in the country, because remember the three that are really causing havoc in many parts of the world is the UK one, the South African one, and the Brazilian variant of COVID-19. So yes, we're in the third wave. We have vaccines, yes, but 1 million is the first batch we had. Tonight we had 100,000 doses from India. We have 48 million people in Kenya, and I was listening to your interview with Dr. Kalebi Yvonne, and he said not everyone is going to get it. Even if we get the numbers the government wants, just up to 15 million people. So it's just being careful, be careful, be careful. Remember how almost paranoid we were last year? I think we need to go back to that because infection rates are going up.
Ashuri?
Yep. What I find interesting in the revelation today that Honorable Raila Odinga is COVID positive is that even political leaders are human beings. I mean, there's nothing worrying about it. There's nothing to hide. When other Kenyans have tested positive, some have opted to share the information. So, and I think this is a good trend. Let leaders also tell the country the truth. This is where we are. This is my situation. It helps deal with the speculation that we see. Look at what we've been treated to in the last 3-4 days in Tanzania. I'm looking at the now that Jamila has shared a few statistics, let me also share some that I also saw some Gituko, our colleague, enumerate in his story today. 1,352,126 tests so far. Total infections 111,185. But the number of people who have recovered is 87,994. That's about 79.1% of the positive cases. The number of deaths 1,898. That's about 1.7%, and the active cases 21,292. That's about 19.1%. So I mean, COVID is real. It is here with us, and I would encourage that as many leaders as possible and people in positions of influence, once they test and for circumstances they turn positive, let them share with the public so that the public also gets to understand what we are dealing with. But ultimately, it is important to take care. We've seen in the last 1 month, 2 months, campaigns have been so much. And when you see that, and our political leaders are out there engaging in political campaigns, and unfortunately some turn positive, it also leaves us wondering what is happening to the members of the public. And secondly, now that Honorable Raila Odinga has tested positive, I'm trying to imagine the whole business of contact tracing and everybody who he may have come across. Last week, he was in, was it last week? He was in the Coast region.
Earlier this week,
yeah.
Well. State House, was
yeah.
it?
So let contact tracing start, and I think it is an important part of this, so that whoever he may have interacted with, they also go through the test, so that we are all safe. But suffice to say, COVID is real. All of us can get it. In fact, I remember Mutahi Kagwe saying, everybody can get it. And that's where we are.
I think for me this comes on a rather significant date. So it is exactly on this date a year ago that COVID-19 was declared a pandemic by the World Health Organization. It is also exactly on this day that the first case, positive case in Kenya was recorded, and then it was reported the following day on the 12th. And it's coming, a few days after we are now well and truly into the third wave. Something Dr. Kalebi said to me earlier is, think about it this way. Remember all of these restrictions, what was the purpose? It was to make sure that our hospitals are not overrun. Guess what? They are. The government itself saying ICU facilities in Nairobi private institutions are full. I believe the KNH one, had been closed for renovations, and they were trying to upgrade the ICU facilities, especially when the numbers had gone down. They're still in the process of upgrading those facilities. So right now, anybody needing critical care will not have any space in Nairobi. if there was ever any sobering statistics right now, is that our hospitals are already overrun. We're in the third wave, and so nothing could be more sobering or staggering, you know, on a day like today. And then, you know, when we receive the news of
add that to
ODM
what is
leader.
happening in the counties, Yvonne.
Yep.
If Nairobi is struggling, you can imagine what is happening in the other parts of the country. Because you remember those statistics that we shared here at that time? Some counties did not have a single ICU bed.
That's right.
Some have tried. So if Nairobi is in such a crisis, then you can imagine what is happening elsewhere.
And just to add and to reiterate, you know, what was said is that the number of deaths usually lags behind with the increase in infections, because when you have more infections, of course, you know, the onset for those that are symptomatic, the onset of the symptoms and, you know, the disease takes its toll. So we're seeing some increased number of deaths now, but there's a likelihood with this going trend that we will see more deaths recorded in a day, on a daily basis for some time, you know, in the next 2, 3, maybe 4 weeks to come. So, you know, it's just a reminder, you know, of where we are now. And that vaccine that we're saying we want 30% to have been vaccinated by 2023, that means in the meantime, we won't have had a big population of those, you know, vaccinated. So that means many of us are still at risk and will still remain exposed. And so the vaccine being in the country, I think, you know, for most of us, let's assume this vaccine, you know, for all intents and purposes really, in our minds, does not exist. Yes, let's just carry on with the protocols as is, because there's a likelihood that there will be a big population, millions of Kenyans, who may never get vaccinated.
And that's so important, Yvonne, because I mean, there's so many things that are still not even known, because even the protection, I mean, how long are you safe after you get the jab? Are you going to be safe for, you know, like 2 months, 1 month, 3 months? Well, nobody really knows. Those statistics are still not in. Now that suggests that even by the time the other people get vaccinated, when the second batch of vaccines come and that sort of thing, you don't know exactly what the status of these other people will be. So as you rightly say, the best thing is really for people to just, you know, just protect yourself.
Back to basics.
Back to basics. Yeah. And you know what is so worrying about this for me is that we have protocols that have been put in place by the government. So there are two things that are happening with those protocols. The first thing is that there are some that are not being enforced at all. I mean, for example, if you talk about movement, I mean, all the curfew is there, but it is easy to, you know, regulate bars and all of these places. But movement on the road, I mean, for some of us who work in this industry that is part of the essential services, who move late, you know, even after this show, we'll be moving around. But you see a lot of people driving around, you wonder, like, where are they coming from? And did that
was there a new list of essential services providers?
And also the roadblocks that we used to find, they are literally non-existent. And then beyond that, there is also the disproportionate, or shall we say selective application of all of these things. So whereas you have other places that are shut down and all of these things, but things are still going on. Some people have all these rallies and all manner of things that are going on. And so I think that this is really a call back to basics, as someone said here, that we get back to where we were, both at a personal level, where people are really watching where they are, watching where they are going, what spaces they are going. Do you have your mask? Are people sanitizing and that sort of thing? Those markets, remember there are markets we used to go to and you couldn't enter a market before you washed your hands. And now people are going about whatever they want at any point. Actually, I know someone who spoke to people at a market said, but how is it that these days you people don't require people to wash their hands before they come in? They said, well, we didn't want our markets to be shut down. So that is really what is going on now. They really don't care. And that is the general carefree attitude that you see around them. You know?
And Joe, you talk about going back to how we used to do things. What happened to contact tracing? Are we still doing it? I don't think so.
Well, they said that once you have community transmission, it becomes very complicated.
Well, but
there are so many things, even how seriously we take this thing. You remember how they would arrive in a neighborhood and everybody's wondering what's really going on. Now you hear that someone is tested positive and everything. No one even bothers if you test positive and you're probably isolating at home and all that, most of the people you talk to, there's no one who even gives them a call to find out if they are really isolating at home. Are they walking around, going to the supermarket, and that's
or even,
remember,
or even how the disease is progressing. So what's happening a lot is that many of the people who are asymptomatic in the beginning start to exhibit symptoms, and by the time they're seeking medical attention, the disease has progressed, quite rapidly and very far. And so that's why you're starting to see, more hospitalizations, more persons requiring ICU care. And I just want to add, it's important for us to understand when we say ICUs are full, they're not entirely full of COVID-19 patients. Remember, for some of the private hospitals, like, one of them, I think, has about 5 ICU units, and only 2 are dedicated to COVID, because remember, people continue to fall sick and requiring ICU for other ailments. So that just tells you, how critical this is. When you take a look at the ICU capacity, remember, it's not just for COVID-19 patients. We continue to be sick. There's still cholera, cancer, diabetes, heart conditions, and various other ailments. So when we're saying ICU is full, it's not just for you if you're a COVID patient, but it's for millions of others who have several other, diseases that would require intensive care.
And speaking of following up on how someone maybe who's tested positive, or someone who has arrived in the country and all that, I remember I traveled, I was away for a couple of weeks, and I remember I got a call every single day to give if I had any symptoms, if I had any, what my temperature was, and someone would come and check every single day just to make sure that you're not, you don't have the virus. And then we talk about vaccine, and you've mentioned that please, people have to know that not everyone is going to get it, because we are depending on vaccine about tunapatiwa through the COVAX initiative, which tries to at least make sure that there's equitable distribution of the vaccines. They don't even have enough as it stands to be able to give all these countries in the world that are able to afford the virus, the vaccines. Then you compare it with the rest of the world. I was reading a report about the US, where about almost 60 million people have been vaccinated in the US as of now. That's about 23% of the adult population. And they're vaccinating, I think, about 2 million people or more every single day. It's because they are able to buy all these vaccines. And then, but now, and of course, they're still having people dying every single day because of the severity of the virus in those countries, because US is one of the countries that was most affected. But then now they're giving out new protocols in terms of people who've been fully vaccinated, because as you say, Joe, we don't know much about how long your immunity would last. They tell you you've been given a vaccine, the first dose today, you get the second one after 8 weeks, and then 2 weeks after that you're said to be fully vaccinated, and now you can say that I'm protected. And they're saying now people who have been fully vaccinated can actually gather indoors and masked with others who have been vaccinated, those who have not been vaccinated. So unaweza kuwa you can be allowed to now meet. In fact, for lots of these people, now grandparents can get to see their grandkids and all that, which is
the most famous line is now you can hug
your grandmother. But still, as you mentioned, we still don't know a lot about these vaccines. Today we were saying there was something about, I think, the Moderna vaccine causing clots. I was reading somewhere. It's AstraZeneca one, and they're saying, it's causing clots as one of the side effects, and some people are worried about taking the vaccine because of the side effects. So there's still a lot more we don't know about these vaccines, because they were developed quite fast. The tests
and I think that's where we should start as a country, Joe, with what Jamila is saying. There are so many unknowns about the situation we are in, but there's some basic knowns that are very, very worrying. Like, if only about 15 million people are expected to be vaccinated by 2023. How are we going to live between now and 2023? We are planning other things, including referendums, elections, but only 15 million people out of 50 plus million people that we have. I know we keep talking of...
And it's not at once.
And it's not at once.
Right,
So there are so many unknowns, but I think as a country we need to work with the knowns. So if you are queuing for vaccines whose efficacy is still a running test, basically, and I don't want to really doubt and pour cold water on what the medical fraternity has done, but this is an evolving situation. We are all trying to see what are the side effects, and we have very different reports coming from different places about how people are responding to the vaccine and the side effects and all that. There are so many of these things that we need to buy time, and we can only buy time as a country with the basics: masks, social distancing, and movement restrictions. And but the movement restrictions also have to be consistent. We keep becoming tough at night, but very okay during the night, as if in Kenya we have a nocturnal variant of COVID-19.
No, the virus, works
moves
during business hours.
Only at night.
Yeah.
And somehow the virus is okay with political events, but it's not okay with church events, and not okay with
bars, burials,
birthday parties and burials.
My pastor asked me why they can't have crusades, but they keep seeing all these huge rallies happening everywhere in the country.
Look at that. Those inconsistencies are part of the reason we might continue paying a very, very high price for COVID-19.
I look at it this way, Joe. Everybody is expecting that the president is going to speak to the nation.
Francis Nakujua, I know you.
Story, stop running set up.
Tell us.
Just tell us.
I don't have any more Kenya.
Do we change the breaking news?
Yeah, right.
As you speak.
Yeah, I think so.
You know, I look at it this way. Now that everybody is expecting the president to speak about the COVID-19 protocols and guidelines and regulations, I think probably it should start with a review of what has been done since the last address or since the last statement. What has worked, what has not worked. Because, you know, Kenyans are also observant, and they're observant in the sense that if the last statement, for example, I think it was on January 2nd this year, if we're told only 150 people can attend burials, how is it that some burials we've seen thousands of people attending?
In a tent, in closed
in a stadium.
Yeah, in a stadium. Or does it matter whose burial? Or does the coronavirus select where it can spread, whose burial and whose burial it can't? So those are some of the factors that we must consider. If political rallies were banned, how is it that they're still continuing unabated? And we see leaders have no masks, the people they're addressing have no masks. So is it working, is it not working? And at the same time, if you enforce certain things, how is it that they are only enforced for certain people and not for other people? If you have curfew at night and other businesses are closed, how is it that political rallies, which is political business, is going on? You know, so if we must apply the rules, let us apply them collectively.
Or not.
However, random thoughts. I don't think the curfew will go anywhere. It will still remain.
Breaking news.
Maybe extend it a little bit to about 11 or thereabout. Maybe.
Extend it to 11?
Yeah.
Okay.
From 10 to 11, maybe.
Okay.
11 to 4 or thereabout. Maybe a few movements here and there.
We're listening very carefully.
Just random thoughts.
Okay, we need to move on, but there's been a lot of speculation across the board. I mean, in Tanzania, and I mean it's been in the papers and everywhere, people wondering where the president is, and I think it's interesting that there hasn't been a lot said about that. I saw there was a statement about people being warned against spreading rumors, which is great, but it will be even greater if there would be a real conversation, at least some information from the government about what's going on, because those are very serious rumors that are doing the rounds.
The easiest way to eliminate all rumors about what is happening in Tanzania and with their head of state is to actually give information. There's a void of information, and therefore, of course, it'll be filled. The vacuum and the void will be filled with rumors and speculation, and that always travels much faster than the truth. But that's only if the truth gets a head start. And be open about it. I mean, I think, Francis in the beginning said, COVID-19, it is what it is. There's been millions and millions of recoveries recorded not just here, but worldwide.
And there's nothing wrong with a leader being
And there's
sick.
nothing wrong with it. I mean, we're not infallible. Nobody is. Whatever the case may be, the only way to stem the spread of rumors is to actually fill it, with information that is verifiable and and timely as well.
And that's a culture, quite frankly, that we just need to deal with. And it happens a lot in these parts of the world where it's almost as if it is someone's fault for them to get unwell. I mean, it's not. Even if he's unwell, people get unwell. If he's fine, then someone just says, well, you know what, you guys are just speaking. Here he is. I think it will just help to deal with that issue either way. And
it is an understandable, safe story. It's COVID-19.
Anyone can get it.
It's not something embarrassing. Boris Johnson, the Prime Minister of the UK, had it. Donald Trump, before he was defeated, had
the Canadian Prime Minister.
Canadian Prime Minister had it. Bolsonaro in Brazil had COVID-19. So even that bracket of society was getting affected by COVID-19. So there should not be any embarrassment among African leaders especially to declare that they are COVID-19 positive. The only tricky thing and why we are finding ourselves in the situation we are in with regard to the President of Tanzania, John Pombe Magufuli, is because of the very official position he had taken about COVID-19, taking his country in a different direction in terms of COVID-19, denying the existence of the disease. And so it would be, and you could see the discussions in the social media, the irony, if Magufuli is COVID-19 positive and in hospital. Because let's make this clear, we do not know where John Pombe Magufuli is. It could be in Chato, just taking a break in his home. There are reports that he is in Nairobi, some hospital, we do not know. But if eventually it emerges that he was...
The opposition leader who...
Tundu Lissu
has been making those kinds of claims. But they need to be clarified.
He's been making those claims, but they have not been officially verified. Like Yvonne, you're saying, the treatment to rumors is confirmation of the fact. Is it? Where is John Pombe Magufuli?
Right. Somebody told me that a rumor becomes the truth when it is denied. So let's see. But the easiest way to deal with this would have been his appearance. Here I am. Where are you saying I was? Here I am. But the fact that that has not happened, then it confirms a few of the things that are being said. And I think this is it's an African problem. African problem in the sense that there is this mystery about our leaders being sick. And every so often, you will see or you will hear they have been flown to some European nation or America or wherever. I mean, there's nothing wrong with a leader falling sick. Just tell people the president is unwell, he is recovering, and this is the situation, so and so is in charge, and the government is operational.
Those lines.
But the moment you keep silent, unfortunately, you cannot deny people both. You cannot deny them the truth and deny them an opportunity to speculate. So give them one. Either tell them the truth or allow them to speculate.
All right, we need to take a break, ladies and gentlemen, because when we come back, we are going to be talking about that betrayal on the bridge, or is it?